Honorable Ministers, distinguished delegates, Mr. President, Dr. Rosas, friends and colleagues, good afternoon. First of all, I would like to thank Dr. Rosas for assigning this time for celebrating the 50 years of the Radiological Health Program. When the program was initiated in 1960, people throughout the region felt great anxiety because of the atomic weapons testing in the atmosphere. Without any doubt, radioactive fallout was a real public health concern. With help from the U.S. Public Health Service, the Pan American Health Organization responded to the needs of its member states by organizing a network of monitoring stations to obtain data concerning radioactivity in the air and in milk. And indeed, very high levels of radioactive contamination were found in the region. PAHO sent a health physicist to the field to work as the regional advisor in radiation protection and to organize radiation protection services. In some countries, with PAHO assistance, radiochemical laboratories were established which enabled the measurement of radioactive strontium and cesium. And as one national health authority commented, this was necessary, just in case the superpowers should decide to test on each other's territory. Fortunately, that never came to pass, but for much of the world and for many years, that was a real and continuing threat. Radiation dosimetry services were established so that radiation protection could be implemented and radiation exposure could be measured. Also, surveys were made in the hospitals and clinics. As the radiation protection professionals worked in the hospitals, they noticed almost the complete absence of a critical team member, the medical physicist. In fact, about 1970, there were only a dozen medical physicists in all of Latin America and the Caribbean. With PAHO leadership and collaboration, medical physicists were trained and dosimetry laboratories were established. Now, even though there is still a large deficit, there are approximately 1,000 medical physicists working in radiotherapy and diagnostic imaging in the region. PAHO also observed the situation regarding the lack of access to even the most essential diagnostic imaging services in the small hospitals. Consequently, soon after, a revolutionary new type of X-ray machine was unveiled at the University of Pennsylvania, PAHO organized a meeting to develop specifications and to promote basic radiology. Even now, this effort has only been partially successful. While some of the most modern and costly equipment is being installed in the large hospitals, large segments of the population do not have access to good quality, simple X-ray examinations. As the benefits of radiation were introduced and expanded in the region, adverse consequences were experienced by accidents, both in the industrial and the medical sector. PAHO responded immediately to request help for the victims and also to help the authorities to understand the cause so that these would not be repeated. PAHO joined with other international organizations to prepare guidance for preventing accidents, along with responding to them if they should occur, as well as the basic safety standards for the protection against radiation in normal activities. One of the main responsibilities of the medical physicist is quality assurance, whether it be to assure that the correct dose is delivered in therapeutic treatments or that the best quality available is obtained in imaging procedures ranging from plain chest X-rays to mammography or complex computer-assisted imaging. PAHO has promoted quality assurance for 4 decades and has organized training courses and symposia throughout the region on this essential activity. Also, PAHO has stimulated and supported research by national personnel concerning image quality and coordinated significant inter-country research projects. Upon request, PAHO has provided guidance and collaboration during the planning and construction of cancer treatment centers and complex diagnostic imaging facilities. In addition, As more and more complex and costly equipment has been introduced, PAHO has cautioned and advised about the need for adequate supporting infrastructure and management, especially with regard to human resources, so that these costly investments will be a true benefit rather than an expensive detriment. Lastly, but far from the least of the radiological health program's efforts is preparation for response in case of a disaster, and cooperation with the countries and other international organizations to ameliorate the effects if a disaster should occur. Details concerning what I have mentioned are available in the various PAHO budget documents, the annual reports of the Director, Health in the Americas, and on the PAHO website in the history of the radiological health program. Also, as a visual summary that has been prepared and is shown in posters that are in the lobby. In closing, I would like to remark on a theme that I have attempted to weave. The radiological health program has, first of all, 1, responded to the priorities and requests of the member states. 2, has studied the situation in the countries and presented a clear and accurate information to its governing bodies. And 3, with a strategic vision toward the future, proposed and promoted practical actions and policies. Through its competent and dedicated staff, the program has earned the respect of national authorities and international organizations, and the PAHO member states have at their disposal the latest and most accurate information concerning radiology and radiation protection. Thank you for this opportunity to share a few thoughts with you. I have been so fortunate to serve the organization that I love for more than 50 years, or almost 50 years of the program. It is now my pleasure to recognize my successors as advisors in radiological health, Carrie Boras, and Pablo Jimenez.
Gracias, doctor Hanson.